Hello, I'm Dr. Brandt Gibson, and one of the things that we see people on a regular basis for is tendonitis. What is tendonitis? By definition, tendonitis is an inflammation of the tendon. This can happen from straining the tendon. This can happen from overuse, where you've just done too much on it. This can happen from just swelling in the tendon itself. All of these, basically, an inflammation of the tendon is the definition of tendonitis. So let me give you a little bit of background on what tendons we commonly will see this in. So if you look at the ankle, you get the foot right down here, and you got the ankle attached. You got the Achilles tendon, of course. That's one of the more common ones that we'll see. We'll see an Achilles tendonitis, which is an inflammation of the Achilles tendon. On the inside of the ankle, between the legs, you got the posterior tibial tendon that runs right behind the ankle bone and then down to the arch of the foot. This can also get pretty good tendonitis. It can also get to the point where you get tendonitis enough that it starts to not function like it's supposed to, and it starts to fail. You get posterior tibial tendon dysfunction. On the outside of the ankle, you can also get there's two tendons that go right behind the outside of the ankle called the peroneals that they cross down in the foot. One of them attaches to the fifth metatarsal, one crosses underneath the foot. They can also get tendonitis, and typically you'll get pain when you roll your foot out in those kind of situations. And then another common tendon that will get tendonitis is the anterior tibial, which is right in the front of the ankle. It lifts the foot up. You get tendonitis in that as well. Now, in saying that, you can get tendonitis in any tendon, but those are the common ones that you'll notice in the ankle. Similarly, you can get a tendonitis in the extensor tendons, the tendons on the top of the foot to the toes. You can get tendonitis in the flexor tendons, or the tendons on the bottom of the toes, especially in individuals that have contracting the toes or something like that. Or if you were to strain a toe, injure a toe in some way, you can also get tendonitis in those areas. So what do you do in these cases if you have a tendonitis, if you have this inflammation of the tendon? Well, just like any other strain, any other injury, any other sprain, you're going to actually treat the tendons with the exact same acronym, RICE, rest, ice, compression, elevation. Rest, you want to limit the motion. So if you got a pretty good tendonitis, one of the things we'll do, for example, with Achilles tendonitis, you do a heel lift to take the pressure off the Achilles tendon. You can put people in boots or in ankle braces to limit the motion that's actually straining that tendon. Putting in post-op shoes, for example, with a tendonitis to the toes, because that, again, limits the motion. Or even just taking you off your foot, that also rests that tendon. So rest is limiting motion. Ice, anytime you have an inflammation, ice can be beneficial. Compression, wrapping that tendon, or wrapping that the foot or the ankle, ace wraps, those kind of things to compress, to keep the swelling out. That also helps the inflammation. And elevation. Gravity is a enemy when it comes to inflammation. If the foot's hanging down, you're going to get more inflammation. If you lift it up, that can help as well. Other things that can help tendonitis, a lot of times, well, we don't do cortisone shots with tendonitis because you worry about weakening the tendon. But you can do an oral steroid. You can also do the MLS laser, the laser treatment where you actually decrease pain, decrease swelling, and stimulate healing. That's a very valuable treatment for tendonitis as well. So if you have a tendonitis, if you got an inflammation of the tendon, you're saying, okay, I've got pretty good pain, but I know it's not been injured, I don't have any tears or anything like that, then you can consider rest, ice, compression, elevation. You consider anti-inflammatories, even possibly oral steroids, or you can consider the MLS laser. All of those are valuable. All of those can help you. And if you're saying, okay, I may have this problem, I may need some help, I recommend you be seen by someone and get evaluated to determine if it really is tendonitis or if it's a tendon injury, because they need to be treated a little bit differently. If it's a tendon injury, depending on the extent of the injury, you may have to get it repaired. So look into it. Make sure it's a tendonitis. If it's a tendonitis, you know how to treat it. I'm Dr. Brandt Gibson. If you'd like to get additional information, you can go to utahfootdoc.com. We'd love to give you additional resources. We'd love to find a way to help you get better. And if necessary, you can come see us. So happy to talk to you. This is Dr. Brandt Gibson. Have a great rest of your night.